My name is Ballentine Carter. I'm a professor of urology and oncology at the Johns Hopkins School of Medicine and director of the Adult Urology Program at Johns Hopkins Hospital. Prostate cancers are thought of as a group of diseases, not just one disease, but a group of diseases that are caused by a combination of genetic and lifestyle choices. So we're all born with a genetic profile that either leads to an increased or a decreased risk of developing prostate cancer. But it's possible to modify that profile, or the genetic cards we were dealt can be modified by adopting a healthy lifestyle. So the advice I give patients for prevention of prostate cancer is, number one, adopt a healthy diet. And by healthy diet, I mean a diet that is very low in animal and dairy fat, that's high in a wide variety of fruits, vegetables, healthy grains, healthy nuts, but not high in fats and especially charred meats, which have been found to promote development of prostate cancer. The other advice that I give patients is try to control portion sizes. There's no question that people who are overweight are at much higher risk of developing the aggressive type of prostate cancer. Not necessarily all types, but the most aggressive types of prostate cancer appear to occur in those who are overweight. And a third, exercise is an extremely important part of prevention of chronic disease, including prostate cancer. And there's more and more evidence that that's the case. I'll share with you one study that was published in one of the most prestigious journals in this country, a study out of Harvard showing that after the diagnosis of prostate cancer, men who were doing vigorous exercise daily had a 60% lower risk that that cancer would progress and cause harm when compared to those men who weren't exercising at all. To me, that is a very, very strong statement that vigorous exercise should be part of a healthy lifestyle, and the benefits would be a reduced risk for developing and having a prostate cancer progress. The book is the Whole Life Prostate Book, and my colleague Gerald Cousins and I thought it was important at this point in time to inform, to educate men about the prostate gland, and for a specific reason, and that is that I think men have a lack of understanding about the development of prostate disease. So I think about the development of prostate disease very much like the development of other chronic diseases of aging. You know, our Western lifestyle that is very, very heavy in unhealthful foods such as sugars, fats, very low in fruits, vegetables, healthy grains, and full of empty calories, together with a sedentary lifestyle, has been contributing for years and years and years to an epidemic of obesity that we associate with chronic diseases. We often associate, and we all know about the chronic diseases of aging, such as hypertension, diabetes, cardiovascular disease, strokes, some people would add dementia, Alzheimer's disease, all of these diseases. But I think now there's a growing realization that prostate disease really should be added to this chronic disease of aging list. And together with that, diseases of male health, or disorders of male health as males age. So what I mean by that are maladies, issues such as lower urinary tract symptoms that men develop as they age, erectile dysfunction, prostatic inflammation, prostatic enlargement, prostate cancer. All of these I think of as chronic diseases of aging, and I believe the message of this book is really, even at an early age, men can adopt a healthy lifestyle that could substantially decrease the risk for developing these diseases. In fact, what studies have shown, even some of our own studies, is that men at a very early age who adopt unhealthy lifestyles And we measure that by looking at body mass index. Being overweight at a young age is substantially associated with a much greater risk of the development of lower urinary tract symptoms and erectile dysfunction even 2 to 3 decades later after adopting an unhealthy lifestyle. So again, the message of the book is really think about the lifestyle you're adopting. Genetics is not the whole issue here. You can modify your genetic risks by adopting the healthy lifestyle that I describe as a triple play of health. Healthful foods, healthful food choices that is, and that's a diet that's low in animal, dairy fat, very high in fruits and vegetables, healthy grains and nuts. Second, one that is focused on portion sizes. We eat too much in this country as opposed to other countries, and I think that is obviously part of the obesity epidemic. And then the third part is our sedentary lifestyles. We need to exercise. So healthful food choices, wise portion sizes, and exercise daily, I believe, can prevent a lot of the chronic diseases with age. And again, I put in that list the development of prostate disease. A lot of people, including patients, ask me if prostate cancer is on the rise. And the answer is yes, but maybe not for the reasons that you think. First of all, the more we screen for cancer, the more cancers we pick up. So patients will often say to me, is there an epidemic of prostate cancer? Everybody in my office has it. My brother has it. I know lots of people who have prostate cancer. Well, what happens to that individual is that they, in their mind, believe that this is a very, very common disease and I better go out and get screened. And they go out and get screened, and then the cycle gets repeated over and over again. So screening for prostate cancer has a cycle of intensity, and the more people who get diagnosed, the more that get screened. So it does appear that the disease is increasing, but really we're just looking for it to a greater extent, and we're finding more. The second issue is that other than being male, age is the greatest risk factor for the development of prostate cancer, and I think we all know in this country that there's a shift in the population toward older age individuals. So as the years go by with massive screening approaches, increased screening for prostate cancer and an aging male population, it will absolutely appear that we have an epidemic of prostate cancer. Patients will often ask me, what can I do? And I think the message really is not necessarily age dependent. There's no question that a young person who adopts an unhealthy lifestyle is going to be in trouble 2 to 3 decades later because of the cumulative harm from being overweight and adopting a healthy lifestyle, eating unhealthy foods, eating large portions of food. That person's going to be at risk for a long time because of the cumulative damage from an unhealthy lifestyle. But I believe, and I tell patients, you're never too young, you're never too old to adopt that healthy lifestyle that can decrease chronic diseases of aging. And again, the prostate falls into that category. So I'm a firm believer that there are things we can do. I think the Whole Life Prostate Book empowers and educates men about things they can do in terms of adopting this healthy lifestyle. Pain is a symptom that we're all familiar with, and for someone with prostate disease, the pain can occur between the scrotum and the rectum. It can occur at the time of urination. Other symptoms like blood in the urine is something that always needs to be investigated very carefully, and a cancer needs to be ruled out when one sees blood in the urine. The lower urinary tract symptoms that we talked about, urinary frequency, especially if it's new, getting up at night multiple times to urinate, having a sudden feeling that one has to rush to the bathroom to urinate, even leaking urine before one gets there, those are all symptoms that need to be brought to a medical person's attention. So a man who is newly diagnosed with prostate cancer should first take a deep breath and then educate themselves about the disease, the development of the disease, and the management of the disease. Prostate cancer is not one disease. It comes in a lot of different varieties. A very brilliant colleague of mine has described the different types of prostate cancer as birds, rabbits, and turtles. And I don't think you have to imagine very vividly that the birds are those cancers that move quickly. They can leave the prostate very quickly. They're hard to detect sometimes because they do move quickly. But that only represents 10 to 20% of prostate cancers. The rabbits are a little more common, 30 to 40%. They occasionally get out of the prostate, but not always. And they can be detected. And then the turtles are the overwhelming majority. Probably 40 to 50% of prostate cancers are slow movers, non-aggressive cancers. And they are the easiest to detect, which is one of the problems with screening for prostate cancer. We often detect these slow-growing tumors. So a patient who gets diagnosed really needs to know where they fit in to those different types of cancers. And if they happen to have one of the turtles, so to speak, the slow-growing type, then treatment is not always necessary. And that's someone who may want to consider what we call active surveillance, meaning monitoring the cancer very, very carefully with a urologist helping to do the monitoring. And if the disease should change over time, that may be someone then who would then be treated. But the advantage of not treating everyone is, first, we lower over-treatment of prostate cancer, unnecessary treatment. And second, the men who are being monitored often don't ever need to be treated, and if they do, we believe they can be treated at a time when cure is still possible. A patient who is diagnosed with prostate cancer needs to find out from their physician a number of different things. We talked a little bit a minute ago about the aggressiveness of prostate cancer, so the patient needs to know something about how aggressive this disease is. And that comes from the pathologist looking under the microscope and assigning what we call a grade to the tumor or a grade to the cancer. You could think of grade as just how disorderly the cancer cells look under the microscope. The more orderly, the lower the grade, the less aggressive. The more disorderly, the higher the grade, the more aggressive the cancer. So a patient needs to have that information on what is the grade, how aggressive is my cancer. The other thing a patient is going to need to know is something about the stage of their cancer. By that I mean, how extensive is it? And that's generally determined on a digital rectal examination where a physician, a urologist, examines the prostate through the rectum and determines whether there is an abnormality on rectal exam or not. As you might expect, the more abnormal the feeling, the more aggressive the tumor. If nothing can be felt on rectal exam, that's a lower stage tumor and perhaps a less aggressive tumor. So grade and stage are very, very important. And the third piece of information is the PSA level. PSA is not just a blood test for detection of prostate cancer, but it also gives us tremendous information about the extent of the disease. PSA is a protein produced by the prostate. It's prostate specific, in other words, only the prostate makes PSA, but it's not cancer specific. In other words, PSA can be elevated for other reasons, prostatic enlargement, inflammation. And the PSA is not just a marker for the presence of cancer. It gives us information about the extent of the cancer. The higher the PSA, the greater the risk that the cancer has extended beyond the prostate. In general, men who have PSAs less than 4 are much more likely to have cancer that's completely confined. PSA levels of 4 to 10 most often are confined, but sometimes have gone beyond of the prostate already. And PSA levels above 10, certainly above 20, indicate a disease that's probably spread beyond the prostate. So we use PSA to help us understand the extent of the disease. Prostate cancer is a very common disease in this country, and if you look at it only from the standpoint of male cancers, new cases per year, prostate cancer is the most commonly diagnosed male cancer. So we would be talking about over 200,000 new prostate cancer cases per year in 2012. It's the second leading cause of male cancer deaths. Another way to look at how common this disease is to look, and epidemiologists do this, look at the ratio between new cases to new deaths. And that ratio right now is 9-to-1. So in other words, there are a lot more cases than there are deaths. If one were to talk about other common cancers like colon cancer, the ratio of cases to death is about 2.7-to-1. And then if one just took all male cancers together, the ratio is about 2.8-to-1. So what that suggests is that either we're diagnosing a lot of cancers that are potentially life-threatening, but we're just so good at treating them, virtually nobody dies of prostate cancer. The alternative explanation is we are diagnosing a lot of disease that men are never going to die of, and they would have done fine and very well even if they hadn't been treated. So therefore, the proportion of men dying of prostate cancer is very small compared to the proportion of people who are diagnosed.